Started.
Oh, you are now live.
We are live on YouTube.
Okay, thank you. I'd like you to open the July 19th Health Services Committee, and first on the agenda, we have Dee from Office of the Aging. And she doesn't have things on the agenda, but I think you have reports or discussion items. Is that correct?
Yes.
Okay, thank you.
Do I need to pass out an agenda or no?
Nope, they should be all in there.
We
Okay.
should have one.
All
yes.
So the first thing that we wanted to discuss is Roseanne and I met with Janelle and Pat from Warren County Public Health, and then Erica from Hamilton County Public Health the last couple of weeks to discuss reopening the congregate meal sites. As you know, since March of last year, they have been closed due to COVID and the pandemic. So we met with them to talk about reopening them. We came up with a plan, and as of next Monday, the 26th, we will be partially reopening some of them, 1 to 2 days a week. We're going to see how it goes to make sure we don't see a rise in the number of COVID cases with our senior population. And then if it continues to go well, we will open them up further. So for our Hamilton County meal sites, the Wells, Long Lake, and Indian Lake meal sites will be reopening on Tuesdays and Thursdays. The Lake Pleasant meal site will be opening on Wednesdays. For Warren County, the Bolton, Johnsburg, and Lake Luzerne meal sites will be opening on Wednesdays or Mondays and Wednesdays. The other meal sites, which are Chestertown, Cedars, First Presbyterian, Solomon Heights, and Warrensburg. Unfortunately, because of limited staffing and the fact that Warrensburg is at Countryside Adult Home, we're not going to be able to reopen those meal sites right now at this time. But we are hoping to be able to reopen them soon once we get our staffing in place and back up to the standards that we need. Any questions on that?
Oh, I'm sorry. Yes, Supervisor, go ahead.
Thank you for getting those sites.
Yes.
I did notice that you're having 6 feet apart.
Yes. So the seniors, regardless of whether or not they have been vaccinated, we are asking them to still wear masks if they would like to. Anybody that is unvaccinated, we're asking them to wear the mask until they're seated at their seat. And then we are spacing out the seats 6 feet apart, regardless of whether or not they are vaccinated or not. But of course, if somebody lives in the same household, they can sit together. But yes, there will be 6 feet separation between everybody.
We cheaped on microphones.
All right,
Gotcha.
go ahead. Yes.
Thank you. I've got one here. Can you elaborate a little bit on the thought process behind the 6 feet of separation?
Just to make sure in case maybe somebody is not vaccinated, so that we're not spreading COVID if they do have it and they come in, because there is still that potential. So we're trying to keep, because this is the highest risk population, just trying to keep them extra safe.
Thank you.
Anyone else have any questions? Mr. Conover.
Yeah, Dee, just coming off the COVID experience, and other emergencies that have happened, how satisfied are you with the maintenance of our countywide list of homebound people that are homebound? That's something more work. I know when our EMS went to deliver shots to homebound, I received a call as to what was are maintained, but I just would throw that out to you, that, especially during emergency situations, the ability to identify homebound people is very important.
Right.
I know you know.
We don't have a list at the Office for the Aging, but when we do assessments, we do give them the National Grid contact information to be put on their list. And then for any of our clients that have that situation where they are homebound, we keep an eye on them. And then we did for any of our home delivered meals clients or any of our clients with the vaccination when it came out, or the vaccine, I should say. When it came out, we offered all of them that opportunity to get put on our waiting list initially. And then we worked with Janelle in Public Health for Warren County, and then with Erica in Hamilton County Public Health to get them the vaccine. And Public Health actually went out and did the vaccines or coordinated that effort. But we did give them names of individuals that we knew that were homebound.
Yeah. May I continue, Madam Chair?
Yes, go ahead.
For example, during major electrical outlets for outages, for example, garage doors can't open but manually. A lot of the seniors actually can't even access their vehicles because they're not able to even lift the doors. And other types of things that come up in emergencies. But I would just put that out there that the awareness of how to register for the senior or the children or spouse of the senior to register them so that in some way of keeping it current would be extremely. I know there are lists out there. I know we identify people, but it would be interesting to perhaps that you are aware of.
Yes, I'm not sure if there's a central list anymore in Warren County. There was the, do you remember, emergency registry for Warren County, which is no longer active because there was very few people on that. So that's why we kind of keep a list internally for us. For Hamilton County, there's the vulnerable population list, which again is not active in every single community. So it's getting the buy-in. But for Warren County, we had very few people on that emergency registry. But we do have a list that we keep an eye on. Yes.
It would seem that between the health department, their nursing program, delivering healthcare to people in their home, so they would know who's homebound, and the nutrition program, the home delivery, that out of that we could glean. And then I just would put that out there.
Yes. And we do work closely with Janelle and Public Health, and we do keep an eye on our seniors during those emergency situations, the snow situations, the electrical outages, those kind of things. We do keep an eye on the seniors that are homebound or that might need assistance during those times. Yes.
Anyone else with a question? If not, Dee, I think you have something else you wish to discuss with
Yes.
us?
We do have one more item that I wanted to talk about. And this one is not something that I wanted to discuss or that we wanted to bring up, but unfortunately we do. Due to the pandemic, while that is technically kind of almost over, we're seeing the after effects of that. So we're seeing an issue right now in the nutrition program with our supply chain. About 3 weeks ago, we were notified by our main vendor of our food items that they were not going to be submitting a bid in September for most of the items that we get. So our dry, canned, frozen goods, and then our meat items as well. These bids go from either 3 months or 6 months, and that vendor is US Foods. And that vendor typically supplies both Cedars, Chestertown, the jail, and then they also supply all of our other meal sites. So Cedars, Countryside, and the jail, they also get items from Glens Falls Produce and some other vendors. So they're not in as much of a predicament as the other sites. The purchasing department has been trying to be very proactive and reach out to some of the other vendors to see if we might be able to get them to supply the items. But unfortunately, they have minimum case quantities that need to be ordered. So you would need to order a certain number of cases of peas or corn or things like that, which is something that we do not have the storage capacity to have those items. We don't have a central place where we can order a mass bulk of them or a way that we can transport it to all of these locations either, because we don't have refrigerated trucks and those kind of items either. So while we're still trying to work this out and trying to figure out a backup plan, and they have put out these bids to see if we can get other individuals to provide bids for these, I did strongly urge that we do a request for proposal to try to get some other solution in place. So as of, I think it's Wednesday, we will be putting out a request for proposal to include a wide range of things. So it's going to include frozen packaged meals, hot meals, or a combination of both for our home delivered meal program, full service operation of our congregate meal program, and or site management and procurement of food and supplies. Proposers are encouraged to submit innovative solutions based on all information provided herein. However, proposing on all options is not mandatory to be considered for an award, and the county may award to a sole vendor proposing the most comprehensive program or make multiple awards if doing so is in the best interest of the county. So this is not something that we have to give you all the information on today, but it is something that unfortunately we may have to act on before the August board meeting or at the August board meeting so that we have this in place for September. It is something that we are in a dire situation and something that we may have to do. It's not something that we want to do, but we may have to do it.
All right, Mr. Moore, I saw your hand up first.
Yeah, just a follow-up question to Dee. My impression of what we're doing is we are looking at a situation where we're trying not to disrupt services to clients, and therefore we are taking a look, hopefully, as best we can, at every option at our disposal. It's not that we have committed to any one of those
Correct.
options. We just want to see in front of us what all of our possibilities are, and then we'll
Mhm.
choose what's best for the clients. Is that what we're doing here?
Yes, yes.
All right, Mr. Conover?
Yeah, we're hearing this and experiencing at the town level, we're experiencing this as well, our restaurateurs, everyone. I mean, I think it's, as far as this supervisor is concerned, I think that until this matter smoothies out, I think that the board should authorize the appropriate people to take such action as is necessary to ensure that those meals, one way or another, get delivered to a lot of people that's their meal. And that visitation is the only social interaction that they receive. And so I would call, if we were to find ourselves even close to a situation where we need to do things administratively to ensure that that service continues, I certainly completely support that. I'll just put that out there for the other supervisors. We're not talking about putting up a project for next year. Food, nutrition, what people eat on a daily basis. I know we do deliver presently some frozen food so that they have them in outlying days.
Mhm.
Is you thinking that maybe on a short-term basis that we could increase that to ensure that we can deliver meals?
One of the things that we unfortunately may have to look at is, and depending on what we get for proposals, we may have to look at transitioning to completely frozen or chilled meals that are delivered in bulk either once a week or once every 2 weeks. It is not an option that we want to do, but it may be something that we're faced with doing because of this supply chain issue. And in my personal opinion, I don't think that this is something that is going to be short term. I don't think it's going to be a 3-month issue. I think we're going to see it, longer than that, happening longer than that. Like I said, it's not something that we wanted to do or that we want to do. Hopefully we can come up with another solution. If this is the route that we have to go, we do have other options that we are looking at because we don't ever want to take away from the seniors. So if this is the route that we have to go, we are looking at doing things called a pop-up kitchen, which is basically where instead of having the congregate meal sites, all of them, we would have one that rotates throughout the 2 counties. So they wouldn't have the kitchen or the congregate site every single day in that same area, but they would have one at least like twice a month it would rotate in Wells twice a month. And then it'd go like Wells one day, then Bolton, then Chestertown, and it would go throughout the 2 counties throughout the month. And with that, we could do the shopping where the clients could be involved with going to the grocery store, getting the meal, preparing the meal, having the meal, and then having some other program that day as well. So it could be an all-day experience. So we're giving them something additional. We could also do a restaurant dining program where we work with the local restaurants in each community to see if they would be willing to offer clients certain meals that would meet our standards, the NYSOFA standards. And then we would provide them with vouchers to clients where they could go to the restaurants, have that meal, have that social aspect. They could go with other individuals, so they would still have that congregate socialization piece. And then we would reimburse the restaurants for that. So then you're also putting something back into the communities. So we're trying to look at other options as well if we have to do that route.
Thank you, Supervisor. Well, Supervisor Hogan had her hand up before.
Did you have a follow-on to your?
I did, I just,
Go ahead.
Andrea, thank you. I just would put out there that as you look at the options, just be aware in our top management, be aware that one of those failures is not an option.
That's true.
That's my-
And I promise you that
my message today, if you need to
Yeah.
come back, as far as I'm concerned, if in order to prevent that in any way, shape, or form, we need to come back even retroactively for decisions that you have to make sure that food gets delivered. That's fine with me.
And I promise you that we will continue to provide the meals to the seniors of Warren and Hamilton County, no matter what. And that's what I want to make sure that we do by being proactive and putting this request for proposal out there while we continue to look for other options as well.
Thank you. Or Supervisor Hogan, then Mr. Moore.
Thank you.
You're welcome.
It sounds like you are casting a very wide net, and I think that's very smart. We do need to look at all the options. I just, what I heard you say, and correct me if I'm wrong, is that part of this issue is that we do not have the ability to order in bulk, store in bulk, and transport in bulk. I just want to remind you that we also, most of our communities already have trucks traveling around the county transporting food to food pantries. If there's any way that we can assist in the effort to move food around the county, please let our communities know that, because we have a 7,000-pound trailer that we use once a month that could certainly be put to use more than that. But also, Dee, I just have to be clear from the get-go. Personally, I'm not going to support any proposal that brings frozen institutionally prepared meals out to the meal sites. I can't.
I'd like to speak to that, though. My town had to go this way, as Dee would vouch for the frozen meals. And we really haven't had any complaints. We have the driver pick them up on Monday. They have the meals for the week, but they had no other choice but to provide those frozen meals for our people. But all I'm going to say is there have not been any complaints. They feel like, I think, getting frozen meals is better than not getting any meals at all. So, if it is something we have to look into, then maybe it's something we do have to look into. But it does work. We've been on it, Dee, at least for 6 months, have we not, up in Hague?
Oh, longer than that. It's been since I've been with Office for the Aging.
Okay, so I know it's been a while, and ours ended up with the temperature problem. The meals were not hot enough when they got back to Hague from Elizabethtown, and that was the reason they had to go to the frozen meals for us. So, all right, Supervisor, Mr. Moore, I saw your hand up again, I thought.
Yeah, I apologize. You may have hit this, but I may have missed the detail. I'm just not recalling the precise timeline we're working with here in terms of when the U.S. Food, the current contract expires and when we expect the RFPs back.
The current bids expire August 31st. We are hoping to have the RFP back. I think it was the week before August 20th, the week before the next board meeting.
Okay.
Yes.
I wouldn't be
Friday before that.
I hear what Supervisor Conover is saying, but if we have time to get another committee back together, and that's that's a doable thing, I think that would be a positive thing to do, to hash it out in committee.
Supervisor Shepler?
Thank you, Madam Chairman. Something I think that needs to be taken into serious concern here is, although the restaurant idea is certainly inviting, you need to take into consideration the lack of transportation a lot of these senior citizens have. And the meals coming to them and they're receiving the meals instead of going out is something you need to look at. Transportation is a huge issue, or lack thereof. Thank you. Thank you, Madam Chairman.
Anyone else that has a comment? Supervisor Conover.
Just one other sidebar comment, Deb, is that I'm told from people in the food industry that they're experiencing significant price increases as well. And so I just would put that out there for our budget officer, and the county administrator, that that's another issue that's hanging out there. So we should expect that there may be some additional costs.
Supervisor Driscoll.
Yeah, I just wanted to, what Supervisor Conover said, I recently read that we can expect for maybe as long as 6 months to be paying as much as 30% more for most items that we normally consume. Thanks.
All right, anyone else with any other comments? We appreciate you bringing all this information to us. I do think our committee needs to be aware of the problem that you're having dealing with it. We have met previous to this to just go over the RFP and all of that. So I know they're on top of it and they're working hard with that. I didn't know if you had anything else, Dee?
No, that was it. We strongly thank you for your support and your understanding during this, difficult time. It's, like I said, it's not anything that I wanted to come to you with. We don't ever want to have to make a decision like this, but ultimately we want to make sure that our seniors get fed. And we're going to try to do, or we are going to do whatever we need to do to make sure that that is done.
Well, I have no doubt in my mind about that. I know you'll carry through. Now, before I finish with this, I do have a certificate for Dee and for Roseanne. Certifies that Deanna Park and Roseanne O'Rourke has successfully completed skill training in effective team management, leadership essentials, and conflict resolution. So this is something they did on their own time. They received the certificate, and I think we just need to acknowledge them for going above and beyond. So thank you.
Thank you.
Okay, Rob, we're ready. And Rob's is short, not a
Yes,
lot.
I'll be very brief, I think. I just have one quick item. So I have a resolution request to amend the 2021 Warren County budget in the amount of $47,857 to allow for pass-through of 100% state aid funding that was approved in the 2021-22 New York State budget to various contract agencies, and I've attached a table A that shows a breakdown of our agencies and the budget codes, what their contract levels are currently, what it goes to, what the increase is. You can see if you're looking at the table, our increases the revenues match the expense increase, so it's 100% state aid funded. We would like to be able to pass through those funds.
All right, would someone like to make that motion? I'll make it. Supervisor Hogan, seconded by Supervisor Conover. Any questions for Rob? All right, then we'll vote on it. All those in favor? Aye. Opposed? Carried. Thank you. Anything else for us, Rob, or is that it?
No, that was it.
Okay, thank you kindly. We appreciate that.
All right, thank you.
Good seeing you again, Rob.
Janelle and Ton. Are we on Zoom?
No, I think they're coming up.
Okay, so we'll wait for them. Yeah, it can be a real problem though for those seniors, they really, we had a meeting last week. See, I don't have a conduit site. The few people that I have, they go to the homes to deliver, and they're not the people that really could get out. So I'm in that respect. So that's why they're not complaining, because they it gets delivered to their home and they can't. How many do you have, would you say, that come to the site? Do you really? Wow. It's like with social, no. Really? That's amazing. Yeah, I got it. We're only an hour behind anyway, aren't we? I got it. Oh, you have so many veterans today to report, huh?
Yeah, yeah.
Oh, yeah. What are we now, 5? Oh. Great.
Some type of thing, I think, follow-ups. I don't think there's anything.
Outstanding.
Well, right, and if there's any way that you need to be promoting it both among property
Can be good.
and
Kind of a type of situation where,
Good point.
get it out to your own community.
I've been through enough of these emergency, and believe me when I tell you, they do.
work on that.
I guess we're all set, Janelle, so whenever you want to start, go ahead. Thank you.
All right, good morning, everybody. So my first resolution request is to enter a grant contract with HRI and New York State Department of Health to accept public health emergency preparedness funding not to exceed $1,050,999 for a period of July 1st, 2021 to July 30th, 2022. Health Services has received notification from the State Health Department that emergency preparedness grant in the amount of $50,099 will be available for emergency preparedness activities. This is an increase from last year of $474.
All right, someone like to bring that motion to the floor. Supervisor McDevitt, accepted by Supervisor Stroud. Any discussion? All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
Just, Madam Chairwoman,
Yes.
I had my hand up, I apologize.
I'm sorry, I didn't see.
No,
you.
it's all right. We've got people blocking. If you'd allow me, I just have, I would comment. to
Absolutely.
Janelle That we just had a conversation with Dee in terms of health emergency preparedness and maintaining our homebound list as complete as it can possibly be on a countywide basis. Very important during all kinds of emergencies, not just COVID, but all kinds of emergencies, and how to do that well, I'm not sure. We have had lists, but I don't know. I just would put that out there for your emergency planners.
Okay, sounds good.
Go ahead.
Resolution request number 2 to amend our lead poisoning prevention program grant contract to reflect a new contract number of T36504GG and to extend the contract an additional year terminating September 30th of 2021. The grant amount is in the amount of $23,001, which is the same amount. The original contract period was October 1st of 2015 through September 30th of 2020. And the extension will allow our ability to continue our grant program activities and to seek reimbursement for those expenses. The state changed the contract number to reflect the extension.
All right, thank you. Would someone like to make the motion, bring that to the floor? Supervisor Hogan, seconded by Supervisor Stroud. Any discussion? Yes, Supervisor Hogan.
Since it's going to end in September, is it fair to ask, how are we doing with that program?
Well, I believe with COVID, everybody was taken a little bit aback. Our activities to follow up on kids with elevated lead certainly happened throughout the pandemic. Even though we were doing other things, we certainly were following up on any elevated labs. I think the state's just catching up to be able to reimburse us for that. And then we should get a new letter to then go October 1st, 2021. You know, we'll catch up at that point in time.
Thanks.
Any other questions? All right, we'll vote on that then. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
All right, the next resolution request is to authorize the Director of Public Health to purchase a metal plaque and a tree to memorialize Joan Grishkot, as mentioned at Friday's meeting, who was our first Director of Health Services, who passed away July 8th. We'd like to memorialize Joan Grishkot's contributions to health services and the community. Health Services is seeking authorization to work with DPW Superintendent to purchase a metal plaque with raised lettering and a silhouette of Joan, and also to plant a tree in her memory.
Wonderful idea. Would someone like to make the motion that we do that? Supervisor Hogan, seconded by Supervisor McDevitt. Any discussion? All right, we'll vote then. All those in favor? Aye. Opposed? Carried. Thank you.
All right, I'm going to turn the floor over to Tom Driscoll, who'll do our fourth resolution request, and then you can do your expenditure report and the comparison.
All right.
Attachment 4 is just moving money. We're estimating about $1,000 for the plaque and for the tree. So I'm moving money within the preventive program, that $1,000, and that's attachment 4 for budget transfer.
All right, would someone like to make that motion for the transfer then? Supervisor Conover, second by Supervisor McDevitt. Any discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Tom, go ahead.
Attachment 5 are our financials as of July 7th. And you'll see that when it comes to year-to-date for salaries, we're at 41.62% of the budget, where last year at this time, we were at 45.85% of the budget. Again, to bring to your attention, as we all know, that a lot of the overtime and a lot of the part-time salaries are related to COVID. Related activities for the year. We've started with the immunization clinics, so that's where most of those hours have gone in the contact tracing. And then attachment number 6, which is the next page, is again comparing last year to this year to give you an idea. Equipment, we do have 3 new vehicles that we now have got. And the other thing we had to get was to update a lot of course, we found this with everyone working from home, and that a lot of our laptops weren't updated and needed to be updated to work with state programs. So we did have to get some laptops for our preventive program, our disease program, our early intervention, and our preschool programs for them to use. Employee benefits are under slightly, again, due to salaries, savings and salaries. Contractual expenses, again, you're starting to see that up compared to last year. Of course, as you know, with COVID last year, our expenses, at least with transportation with our preschool program, we still had to pay tuition, but we didn't have to pay for transportation because kids weren't going, they were virtual. So we're starting to see that. We did get a large increase with the transportation. So that's being reflected now in this year. And revenues, again, reflecting, we're very comparable to last year. As many of you know, also, again, that our clinics are starting, at least our rabies clinics, but really, we haven't been having any clinics, no travel clinics, no STD clinics, no, the rabies clinics, we just started this summer, and we're going to try to do like one a month and get into the fall with a few of those. So that's where we stand with that. Do you want to go into referrals?
All right, does
Person
any
next.
committee member have a question for Tom with the finances? No one with any questions? All right, thank you very much, Tom.
I'll move on. I was just
Okay.
talking to Janelle. Next, attachment 7A and 7B are our referrals for our home care program. In talking with Val, just to try to see, it really is tough to compare this year to last year because as we all know with the COVID, even though we're starting to come back and we have some numbers. So she said she would prefer that we compare like last month to this month and get a better idea where the things are. One thing is wound cares. We definitely went down, and again, due to staffing, she has had to decline a few referrals, basically those that are wound cares, because they are time consuming. And right now, we still have some positions open. We're still waiting to fill those positions. Also to note, the PT visits went down, and she said also to note that that's probably due to joint operations that haven't been done on joints. So those numbers are down a little bit for the month of May. And that's it.
All right, thank you.
All right. You also have your emergency preparedness activity sheet that lists a lot of our activities that we did the month of June, July. And with our rabies report, we've attached that as well for your review. And I also gave you the attachment of our rabies clinics so that you can help publicize those in your towns and throughout the board to be able to do that. That's what I have for that. There are no referral of pending items. And now we go to the privilege of the floor. And I was just going to give a very brief COVID update. We worked hard over the weekend, very disappointing week for us last week. In addition to today, or over the weekend, we had 8 cases yesterday. A lot of those cases had to deal with camps and children programs. So the game's not over yet. We really still have to advocate for vaccination. There's the word on the street is, well, everybody that's wanted to get vaccinated has had opportunity and they've been vaccinated, and the people that haven't don't. We have to think of creative ways to get everybody vaccinated in our community. Still being about 65% of our population with double vaccines or the 2 vaccines. That's really not to 70, which is really the minimum. I think from the start, I've said I wanted to shoot for 100%, knowing that even if we got 85 or 90, that would be good. But if you shoot for 70%, 65% is not good enough to hang our hats on to say that our community is prepared. With the variant, even though I don't specifically know that it's in our county, we do know that the variant's about 60% more contagious. And we're seeing our school and our young kid population certainly spreading this quickly. It can go to a grandparent that actually has done everything they've tried to do to be vaccinated. We're seeing breakthrough in all 3 vaccinations. I think last weekend and early last week, I had 9 cases that were vaccinated, all 3 vaccines that got COVID. Those are people that have done what they could do to protect themselves that are still getting COVID from people that have traveled, or people that have been sick that have gone to work, or people that have been sick that have attended picnics, graduation parties, functions, fundraisers, et cetera. But I think this weekend in general was very difficult, not only from a workload standpoint, but just looking at the populations that we were dealing with and just looking at, the amount of people that had to be notified of their exposures, and just knowing that the majority of those populations are populations that can't be vaccinated. So I would encourage each of your towns, if you'd like us to be there, we're happy to come again. We're at the Tannery tonight from 4 to 5. We're at Take a Bite in Glens Falls Wednesday. Friday, we're in Brant Lake for their food truck night, and happy to be wherever we need to be. If you have any influence with family and friends, please encourage vaccination. We will set up a clinic. Fort William Henry called me yesterday, and we're going there today at 3 o'clock. They initially told us we had 1 person, they're up to 5. So, every one person counts in this game of getting everybody vaccinated, and our department will do everything we can. We'll stretch, we'll send nurses wherever we need to vaccinate school populations, camp populations, business populations, town populations. We still have our home care people that we're happy to vaccinate. But what I would like to really do is plead to this committee and plead to our board and plead to our administration, plead to our county employees, plead to our community. If you're traveling, be mindful of all the things that we did throughout the year to keep ourselves safe with social distancing and mask use. If you're sick when you come back, stay away from work, stay away from school, stay away from camp, stay away from grandparents until you know that you don't have COVID. If you have sniffles, don't show up to work until you get it checked out by a provider and get tested. If you're vaccinated, if you have the sniffles, you still want to go to your doctor. You still could have COVID. So with this variant, with all the travel, with all the vacationers, we want to make sure our community continues to be safe. So I guess that's my soapbox. And if anybody has any comments, I'm happy to kind of entertain those.
Supervisor Hogan.
Well, I just sneezed. Now I feel bad. But I do have allergies. Fair.
Clear the room.
I'm discouraged. Thank you for the update.
Yes.
And thank you for the encouragement, but I'm discouraged that a year and some months into a pandemic, to have our Director of Public Health pleading with us to do anything discourages me. We should be handing you the world on a platter. Honestly, anything you say, we should be giving to you. So please join me, colleagues, in putting on a real push to get the vaccination going here. This is really important. She shouldn't be pleading with us for anything. Thank you, Dee. Or thank you, Jen.
Thank you, Andrea. And thank you very much, Janelle. You know how much I appreciate all that you do, and I know the committee feels the same way. So is there any other committee member that has a comment they'd like to make? And if you're not on the committee and you wish to make a comment, did you want to say something? Right,
Yeah.
go ahead.
Thank you, Madam Chairwoman. And Janelle, congratulations on Glens Falls Rotary, recognizing
Oh,
the Citizen of the Year.
Yes,
Quite a steamed prize.
that was wonderful. I was very pleased to see that. So if no one has anything else, oh, Mr. Lehman, do we have anybody out there that has a comment or anything?
We actually do have a comment from Kathy Templeton going back to the frozen meal discussion, saying Supervisor Hogan is correct. Frozen meals are unacceptable, in my opinion, for the elderly. Nothing on Janelle's agenda, though.
All right, thank you very much. With that, I'll entertain a motion to adjourn. Supervisor Hogan, second by Supervisor Stroud. All those in favor? Aye. All right, thank you.